Namaskar, this is Dr. Hema Divakar, the Foxy representative to FIGO, speaking to you on the program that's hosted jointly by ARTIST, that is Asian Training and Research Center for Skill Transfer, and also by the Shield Healthcare. The main thing in the world itself is the change, the constant changes that are happening in our lives, as well as the progress that is made by science. And every other month or every other couple of months, we have new data, new information, and it is really the knowledge which needs the wisdom to be spiced all around it, to get the practical points from the leading experts of the world to come and share their experiences of how to translate the theoretical updates in science to the practical benefit of the women that they take care of. So in today's program, hosted by ARTIST and Shield Healthcare, we have very distinguished speakers from Mumbai in the form of Dr. Nandita Palshetkar, who is the president of the Mumbai OBGYN Society and an asset to our organization, who will be speaking on some aspects of infertility, which is called the luteal support. And there is Dr. Sushila Rani with the eminent set of panelists who will also be deliberating on preconceptional care. Well, there was an era when women in pregnancy used to only come to our doorstep just for the process of delivery. Then the change that was brought in was that she has to have a few checkups during her pregnancy. Now, this is an era where we call something as a preconceptional. Even before she embarks on a pregnancy, she has to seek help of the medical professionals to see that the environment within her system is the best and is optimal to bear a healthy child. So all about the preconceptional care, the optimal weight, the optimal diet, the nutritional supplements, and the checklist of what we should do for young couples who seek the care even before they get pregnant. That's the topic for the panel discussion by Dr. Sushila Rani, the past president of the Bengaluru Obstetric and Gynec Society. So within the framework of the leading specialists in the country who are attending this program today, there'll be a lot of deliberations, lot of interactions, everything with a single-minded focus of translating into the best of women's health care in this great country.
This is Dr. Nandita Palshetkar. I'm from Leelavati Hospital, Mumbai. I'm an IVF specialist practicing for the last 22 years all over the country. We are just starting a center at Sakra Hospital, World Hospital at Bangalore. And I would like to tell you that today Team ARTIST and Dr. Hema Divakar has actually arranged a beautiful CME where I will be speaking on progesterone in the luteal support. Progesterone is a very important hormone which is actually known as the hormone of pregnancy, and this particular hormone is very important, especially in infertile patients when we are doing ART, that's assisted reproductive technology. And this particular hormone is given to the ladies after we've done IUI or IVF or ICSI for these girls, and the hormone is continued for nearly 2 weeks to about 12 weeks. And the importance of this hormone is it maintains the pregnancy, it causes changes in the immunity of the women so that she doesn't reject the pregnancy. So this is very, very relevant for the woman to carry the pregnancy ahead. And the important part of this hormone is, since it's taken daily, it has to be really be delivered in a very patient develops compliance. If it's irritating, if there's a problem, then she will not take it properly. So we really need it to be given very beautifully, and so that the patient has the least complaints. And we are lucky that we have so many different progesterones in our armamentarium today, and that is what I'm going to be discussing about the various different progesterones that are available today for the infertile couples. Also do the serum progesterone level, and if the progesterone is low, we supplement it. And of course, it goes on to as high as 100 to 200 nanograms per ml during pregnancy. What is the significance? If you see that there is a 45% rise in your progesterone, that means there's only a 5% chance of abortion in that pregnancy. If there is a delayed rise, we see that in about 18% of the patient.
and two, it keeps on going, neither rise nor decline, or 15% decline. Decline means 100% this patient lands up with abortion.
As excellent counselors, that's a cadre that we need for women's healthcare through and through.
But there is educational qualification required, which is set by ICMR actually.
Yeah, but the counselors in private settings and like for example diabetic educators or educators on PCOS, anybody is allowed to do that as a part of informal counseling.